I'll be taking you through hyperparathyroidism and our objectives for this presentation. We need to know the definition, we need to know the location of this gland, we need to know how the body maintains the normal homeostasis. We also need to know the diagnosis, the types, and the treatment. So before we start with a case study, this patient is known as Peter, who came with complaints of muscle weakness, bone pain, and has a history of kidney stones, to be specific, calcium stones. Some lab results were done and it was found that the calcium levels were 12, the phosphate levels were 1.8. So we'll pause there, then we'll come back to this. So hypoparathyroidism, this is a condition that is mainly characterized by high levels of parathyroid hormone, and this is due to overactivity of the parathyroid gland. So the net effect of parathyroid hormone in blood, it increases the blood calcium levels and decreases the blood phosphate levels. So the parathyroid gland, they are usually in pairs, and they are located next to the thyroid gland as shown. So the parathyroid hormone, this is an 8 amino acid polypeptide hormone, and it's always responsible for maintaining the extracellular fluid calcium levels. So it's always stimulated when there is decrease in serum calcium levels and also an increase in serum phosphate levels. So the normal physiology, when calcium levels in the blood, it falls. When the levels are low, the parathyroid gland is triggered to release parathyroid hormone, which targets both the bones and the kidneys. So for the bones, it stimulates the release of calcium from the bones, and for the kidney, there is production of the active form of vitamin D, which targets the gut, thereby increasing the calcium levels. So for diagnosis, there are various ways of diagnosing it with the biochemical test, which involves hyperkalemia, hyperphosphatemia, and also checking the levels of this hormone. There are also other special diagnostics tests, and also we can look at it using the x-rays, where we'll be seeing osteoporosis and the brown tumors. So like for diagnosis, so for this x-ray diagram, we are having this decrease in bone density, so it will predispose one to this kind of disease. So the types, they are categorized based on the underlying cause, with the primary, the secondary, and the tertiary. For the primary, there is an unregulated overproduction of parathyroid hormone, and this results in abnormal calcium homeostasis. And this affects mainly it's females, and the ratio of men to female is 3:1. So the main cause of primary hyperparathyroidism, it's mainly the single adenoma. Ideally, these are benign tumors, and it can also be caused by hyperplasia of the gland. So this causes there's overproduction of parathyroid hormone, which increases the calcium levels beyond the normal levels and decreases the phosphate levels. So the etiology of these adenomas and hyperplasia in most cases is usually unknown. So pathophysiology, the normal feedback of the parathyroid hormone production is always lost. Ideally, we can have an increase in the cell numbers and also the adenomas that we've talked about. The signs and symptoms due to hyperparathyroidism that causes hyperkalemia, they do include muscle weakness, with fatigue, with nausea and vomiting. In severe cases, it might result to coma, and there is also an evidence of neuropsychiatric manifestations such as confusion and depression. And also there is increase in gastric acid secretion, predisposing one to peptic ulcers disease and other pancreatitis diseases. So the only treatment for this primary, it's the surgical removal of the abnormal parathyroid gland. And this is the only permanent and curative treatment for this primary hyperparathyroidism. So, for nurses, they can manage these patients in acute setting by giving them IV volume expansions, which includes the sodium chloride and some of the loop diuretics once the intravascular volume is restored. Also, other drugs might be supplemented, which includes calcitonin. And calcitonin, it's an antagonist of parathyroid hormone. So it puts more calcium into the bones. And also IV biphosphate can also be given since the phosphate levels of the patient currently is low. So under other kinds of cares, these patients should be carefully monitored. They should also check at the daily calcium intake. For those who lack vitamin D, they should be supplemented, and the nurses should avoid the use of diuretics and the lithium. Other things that can be done, we can use calcium mimickers, and for the postmenopausal women, because they do lack estrogen, so they should be supplemented with low doses of estrogen. So for the secondary, there's the glands are normal, but there's overproduction of this hormone due to another stimuli. It's always secondary to something else. So one, it can be because of chronic renal failure or even vitamin D deficiency. For vitamin D deficiency, it comes about in instances probably one is malnourished or lack of lack of sun exposure and many other causes. For the chronic renal failure, we are having at this point now the patient is unable to excrete normally, and also there is no production of the active form of vitamin D, which plays an important role in controlling the blood calcium levels. So for secondary, for we to correct this, we need to look at the cause. If it's vitamin D deficiency, we need to supplement the patient with this, and also we need to monitor or even restrict the phosphate intake. And also we need to treat the chronic kidney failure, because this is what brings about this secondary hyperparathyroidism. Lastly, we have the tertiary hyperparathyroidism. So this develops because of the continuous hypersecretion of the parathyroid hormone. So the etiology is mainly unknown, but when the secondary or the primary is not treated, it always predisposes one to this kind of infection. So there is continuous oversecretion of this hormone, which increases the blood calcium levels. So for the treatment, so for this patient, ideally there is the total parathyroidectomy supposed to be done because now the gland, they are unable to maintain the normal body homeostasis. Now back to our question. The patient had complaints of muscle weakness, bone pain, and has history of calcium stones. To be specific, or has history of calcium kidney stones. To be specific, the calcium stones. So from the lab results, the calcium levels were 12, and this is above the normal range. It's 8.5 to 10.5. So this is elevated, and the phosphate levels are low. And also the parathyroid hormone was found to be increased. So for for now, the diagnosis of this gland, because the parathyroid hormone is increased and we are having also more calcium and less phosphate, so we are certain to say that the patient has hyperparathyroidism. So the next step, we need to know if it's primary, the secondary, or the tertiary. So because the patient has the history of these kidney stones, so I think this can be a clue, and it can direct us to the specific type of this hyperparathyroidism. We cannot say it's tertiary because initially the patient was okay, and also this the story of muscle weakness and bone pain. Probably the patient has osteoporosis. So at this point, we are certain to say that the diagnosis is hyperparathyroidism, and also to be specific, the type is primary. Thank you for your time. Bye.